The tissue in the inner lining of the uterus is called endometrial tissue. When this tissue grows outside of the uterus in the pelvic organs like the ovaries or the fallopian tubes or the pelvic peritoneum, this is a condition called endometriosis. This is a lifelong disease and can occur in any age of the woman. Even teenage girls can have endometriosis. As endometriosis is a lifelong condition which affects women in many aspects of life, it needs a long-term treatment plan, including surgeries and including medical treatments. Many of the symptoms of endometriosis is related with pain. The main common symptom is pelvic pain, which is often felt like lower tummy pain. This pain can be very severe and you cannot continue with your daily life activities. So this pain usually comes much more severe during your periods. During your periods, if you can have severe cramp-like pains in your lower tummy. The second most common symptom is the pain during or after sex, and you can also have pain during your peeing or pooing. You can also see blood in your pee or poo if you have endometriosis. The endometriosis, the second common symptom is related about the fertility issues. If you're having infertility, the percentage of having an endometriosis is like 50% in infertile cases. There are many different causes of endometriosis. A very well-known theory is about the backflow of the menstrual blood into the peritoneal cavity. This is called as Sampson theory, and this theory is well established. When the blood during the menstruation goes back through the tubes to the abdominal cavity, it can attach and grow into the pelvis. So this can be a sort of endometriosis, but this is not the only theory that can explain endometriosis. The other causes are immunological problems, genetic problems, surgical problems. After some kind of surgeries, endometriosis can develop, and some hormonal imbalances can also cause endometriosis. Endometriosis is usually diagnosed at the gynecological examination and ultrasound. When we do the standard routine gynecological examinations, we usually do transvaginal ultrasound. At the ultrasound, we can see the masses called endometriomas at the ovaries, so this is very specific for diagnosis. In other cases with suffering from pelvic pain or pain related with during or after sex or pain related with menstrual periods, we are usually suspicious of endometriosis. In order to diagnose the endometriosis, we do the pelvic examination, and after the pelvic examination, at the ultrasound, we check both ovaries, and at the back side of the uterus, we can see the endometriotic lesions usually. If you're not sure about the endometriotic lesions or if you're not sure about the disease, then we can go for an MRI scan, magnetic resonance imaging. That is really like 100% accurate for endometriosis. If we're still suspicious and could not diagnose the endometriosis, then laparoscopic surgery is 100% accurate for endometriosis disease. If the diagnosis is to be confirmed by laparoscopic surgery, we go inside the abdominal cavity with a small camera. So with the camera, we can see every side of the cavity, every side of the abdomen, and we can see the endometriotic lesions. If you want, we can do a pathological examination also, but visual examination of the pelvis is very accurate for endometriosis diagnosis. Endometriosis is a lifelong disease, so when you're diagnosed with endometriosis, we usually start the treatment to relieve the symptoms. The main symptom is the pain, and the first step of endometriosis treatment is with painkillers, non-steroid anti-inflammatory drugs. If the painkillers doesn't work, we go with the hormonal treatment to suppress the disease, but there is no cure for this disease. Even if we do surgery to move all the endometriotic implants out of the body, the disease usually comes back to your body like 50% in 5 years. So at this lifelong disease, we usually go with the medical treatment for longer periods of time, and we do the surgery only when needed. If left untreated, endometriosis can progress and cause more symptoms. Over time, endometriosis can affect a person's fertility also. The main treatment plan can be listed as the first-line treatment as painkillers. If it doesn't work, we can go on with hormonal contraceptives. Hormonal contraceptive pills doesn't let the endometrial tissue to grow. So in this way, we can suppress the disease and we can help you with your pain, and with pain relief, you will have a better quality of life. With this hormonal treatments, we also have some kind of injectables which can suppress the hormones. With these hormones, after suppression from the hypophyseal gland of the body, can also have low estrogen levels, and with low estrogen levels, the disease cannot progress. The other kind of treatments are aromatase inhibitors and progesterone treatment. These all suppress the disease and have you a better quality of life and pain relief in long and short term. And if all these doesn't work, we usually go for pain relief to surgery. And with surgery, we remove all the endometriotic implants. And after the surgery, you can have, in order to have longer periods of pain relief, we also add some hormonal supplements after the surgery. Researchers have linked endometriosis with certain types of ovarian cancer. Ovarian cancer histopathological types like endometrioid and clear cell cancers are linked with endometriosis. If a patient undergoes endometriosis surgery with laparoscopy, we just remove specimens to the pathology to see if the endometrial tissue is cancerous. If the endometrial tissue is cancerous, then the treatment for ovarian cancer has to be planned for the patient to have cures. Surgery usually helps for endometriosis cases. When we do surgery, there are different kinds of surgeries to remove the endometriotic cysts called ovarian endometriomas. When endometrioma removal is performed, there are different kinds of surgical techniques. One is the removal of the endometrioma capsula. The other one is the ablation of the endometrial capsula. That depends on the surgeon's preference, but the removal of the endometrioma capsula is the best way to do it in order not to have reoccurrence of the endometrioma in short term.